Why are we referring you? Well, 4 tests have indicated that you may have a rare but much talked about disease called glaucoma. That does not mean you have glaucoma, but there are enough signs that it should be investigated closer. Glaucoma affects only 1% of the population between the ages of 40 and 70, the age most likely to get it. As a matter of fact, a professor at the College of Optometry in Berkeley says that about half of the people being treated for glaucoma don't even have it. You probably are very well aware that we practice vision excellence here, so therefore we are going to refer you to a doctor who practices eye disease excellence, so we'll know for sure if glaucoma is a factor. First of all, what is glaucoma? It's an eye disease that chokes off the optic disc as it enters the back of your eye. It starts on the edges of where the blind spot enters the eye, which goes to the periphery of the retina. So slowly those nerves will die, and then your peripheral vision gets shorter and shorter, only you'll have a very small central portion remaining. What happens when you have glaucoma? Glaucoma is thought to be caused by a higher than normal pressure in the eye, either because much of the fluid is produced, too much fluid is produced, or not enough is released out of the eye. Unfortunately, why this happens is still open to question. Treatment consists of drugs designed to either reduce the production of the fluid or to make the fluid go out faster. Since there's a lot of side effects with the ones that stop the production of the fluid, the emphasis has been on the release of the fluid, and the drug called Zalatan seems to be the drug of choice. Matter of fact, for women, that's a pretty good thing, because what it does is it elongates eyelashes and makes them darker. And you might know right after that drug was discovered, a short time after, they came out with a drug called Latasi that elongates women's eyelashes. Okay, now what goes on in the eye? There are three little chambers within the eye. The first one is called the anterior chamber, the next one the posterior chamber, and the last one is the vitreous. The anterior chamber starts right behind where the clear part of the opening of your eye, called the cornea, and it extends all the way to where you see the iris out in the front. Then just behind the iris to where the lens is in the eye is called the posterior chamber, and then behind the lens is called the vitreous. The vitreous is made out of material similar to ungelled jello. Whereas the posterior and anterior chamber of the eye is made out of material called aqueous humor, which is very similar to teardrops. Now, the fluid that runs through the posterior and the anterior chamber is made first from the back side of the iris in the posterior chamber. Then that fluid, it goes through into the front part of the eye and out the edge of the anterior chamber through a meshwork called the trabecula. Okay, and so if either there's too much fluid produced or not enough fluid produced, then there's pressure on the eye. And so the way the eye is constructed, that clear, the white portion of the eye, when you look straight into somebody's eye, that's called the sclera. It goes all the way around the eye to the back. It's cartilage. It's pretty thick. But where there's a hole in the back where the optic nerve comes in, well, that is the weakest point of the eye. So when you have pressure going back there all the way from the anterior chamber to the posterior chamber, right through the vitreous, it pushes against that optic disc where the nerves are, and they're kind of soft, and they give, and then they crimp up against the edge of the sclera, and that's the damage to the nerve. Okay, what are the 4 tests that we did to determine there's a possibility that you might have glaucoma? The first one we did is we just simply looked inside your eye and looked where the optic nerves came in. The second test that we did is we took a pressure reading with our eye care tonometer to see how high the pressure was in your eye. The third thing that we did is we took a visual field of you to see if there's any, because when you do the visual field, when you check the blind spots, you can tell pretty much if glaucoma might be starting. And then the fourth thing that we did is when we found out that it was suspicious in the visual field we did a visual field very specific to glaucoma. So those are the tests that caused us to refer. So we're going to send you to Zyder Eye. All the information that I just discussed with you about the 4 tests will be referred to them also. And they are the people who practice eye disease excellence. So what will happen there? First of all, they'll dilate your pupil to get a better view of the optic disc where the nerves come in the back of the eye. Second, they may repeat a vision field like we did with a different instrument. They have a favorite instrument. They will measure your eye pressure again. Again, they have a favorite instrument, even though the eye care is very good. They just like theirs. They may perform something called an OCT, which is kind of almost like an X-ray, only far less invasive, where you can get a picture and to see how much those nerves are really crimped in the back of the eye. Then, if necessary, they will begin treatment, and then they will forward a report to us. So you'll enjoy your visit over there. They will take very good care of you. And then we will be seeing you in the future. And again, we're taking precaution here. The chances is, you know the percentage, it's less than 1%. So the chances are 99% that you are okay.